we have this bone, which is the humerus. This is your scapula and your clavicle right there as well. Right, we can see right here the scapula in 3 different views. This is going to be the frontal view, posterior view, and lateral view. This large part is the spine. The top of your spine is the acromion. This top part right here is suprascapular fossa, and this one is going to be the infrascapular fossa. In the anterior view, you have this one right here. This is going to be the subscapular fossa. This acromion right here is this acromion right here, but this is the lateral view. Right here, this is the acromion. So next to this one right there, it would be this one right here. Right, that's going to be the coronoid process. So right here, you have the coronoid process, and this is going to be the acromion right there. In between those two, you're going to have this cavity. This is going to be the glenoid cavity. Here's your clavicle, and this, as you can see here, this is the sternal end, and this is the acromial end. So if we go back down here, this is the humerus. Here, the top part of the humerus is the head. If you have a head, it's because you have a neck. After the neck, you're going to have 2 elevations. This is going to be the greater tubercle, and this is going to be the lesser tubercle. This is going to be the intertubercular line. This is in the proximal epiphysis. In the distal epiphysis right here, we're going to have 2 fossas, the radial fossa and the coronoid fossa right there. That would be in the anterior view. We look at the bones in our forearm, you're going to have the coronoid process and the radial head. So the coronoid process and the radial head will go into these 2 fossas right here. How these 2 fossas articulate with the radius and ulna, because we're going to have that trochlear notch right there. They will touch this area right here, which is the trochlea, and the radial head will go into the radius right there. So then the radial head will articulate right here with the capitulum to go inside the radial fossa, and the coronoid process, which is this one, will go inside the coronoid fossa. But how does it go inside? Because it will pivot right here in the trochlea. If you look at this, the top part, this is the olecranon. But this is in the posterior view because the olecranon will go right here into the olecranon fossa, as you can see right there. Those are the bone markings that you have in the proximal epiphysis. In the distal epiphysis, we will have these 2 areas right there. These are going to be the styloid. One styloid process belongs to the ulna, and the other one belongs to the radius. The styloid process are going to articulate with these bones that you have in your wrist. The bones that you have in your wrist, as you can see here, they're going to be called carpals. In there, you're going to have the triquitum, trapezius, scaphoid, capite, hamate, triquitum, and lunate. These bones form the palm of your hands. These are going to be called metacarpals. We have 5 metacarpals, 1, 2, 3, 4, and 5. In our fingers, we're going to have phalanges. You can have in here 1, 2, 3 phalanges per finger. These 4 fingers will have 3 phalanges, therefore we have in here 12 phalanges. And this is going to have 2 phalanges. For both hands, we'll have 28 phalanges. We scroll down. This bone right here in green, that's going to be the os coxae or hip bone. This one right here is also the os coxae or hip bone. And right here in yellow, you're going to have the sacrum. These 3 bones together are going to form the pelvic area. If we scroll down, you have the os coxae. In here, you have the ilium. In purple, the ischium and the pubis. So they merged together and they created the os coxae or iliac bone. Now, this big bone has different areas. We're going to have the acetabulum, the iliac crest, the obturator foramen, the ischial tuberosity. So we scroll down the femur. So this is the head, the neck. In the middle of the head, you're going to have the fovea capitis, where you're going to have a ligament that will attach this bone to the hip bone. Behind the neck, you're going to have a greater trochanter, lesser trochanter. In between the 2 trochanters, you're going to have the intertrochanteric line. This is what you have in your proximal epiphysis. In the diaphysis, you're going to have the linea aspera. In the distal epiphysis, in the anterior view, you're going to have the patellar surface. It will articulate your patella. In the posterior view, you will have these 2 areas right here. So this condyle right here, this is going to be medial condyle, and this is going to be the lateral condyle. These two condyles are going to articulate with your tibia. So one of the condyles will go here, and the other condyle will go here. So then the femur will go up like this. These are also going to be condyles, but these are going to be condyles in the tibia. The other ones are going to be condyles in the femur. In the femur, you're going to have in between the two condyles this cavity right there. That is going to be called the intercondylar fossa. What goes in the intercondylar fossa is going to be the intercondylar eminence, which is this one right here. Below the intercondylar eminence, you're going to have in here the tibial tuberosity. This will be the characteristics that you have in the proximal epiphysis. In the distal epiphysis of your tibia, you're going to have the medial malleolus. Next to the tibia, you have the fibula. That as well. This is the posterior view. Right there in the posterior view, you can see here that you have the head. The top of that is going to be the apex. That will be in the proximal epiphysis. Distal epiphysis, you're going to have in here the lateral malleolus. These malleolus are going to be necessary so we can articulate these bones with the bones that we have in our foot. These bones right here are going to be the tarsals, the ones forming most of your foot. That's going to be the metatarsals, and then we will have the phalanges right here. This bone that articulates with the tibia and the fibula, this is going to be the talus. This one right here is going to be your calcaneus. Right here, the metatarsals, we have 5, 1, 2, 3, 4, and 5. And the phalanges are going to be similar to what you have in your fingers. We have 3 phalanges for every toe that we have, except for the big toe, right? The big toe will have only 2 phalanges, 1, 2, but then this one will have 3, 1, 2, and 3. Therefore, right here, you will have 12, and right here, you will have 2, for a total of 14 phalanges in one foot. Both foot, obviously, is going to be 28.